Hello, and welcome to this webinar on Equine Acupressure for strengthening of the immune system, the second in a series of 6 webinars on equine acupressure and traditional Chinese medicine. So today we will have a look at the immune system of the horse, both from a Western and a Chinese perspective, and particularly then in TCM on the element of metal, because it plays an important role in relation to the immune system. And then we will finish with a few acupoints that you can use to strengthen and to support the immune system, finished by the question and answer session. So, the immune system. The immune system is absolutely essential for life and for healthy life and to defend the body against any external influences that can harm the body. So to avoid infection or diseases or other unwanted consequences. It is critical to maintain life, and it protects when foreign invaders like viruses, parasites, or bacteria breach the body's physical barriers, such as the skin and mucous membranes, and enter the body. And we will later see the skin plays an important role from a Western perspective, but also from a Chinese perspective. It's just a different approach. And there are 3 types of immunity. That's the natural acquired immunity through exposure to a pathogen and the development of an immune response. The second one is artificial acquired immunity through vaccines. And then there's passive acquired immunity through the Darm's colostrum at birth. And that's equally, there are similarities to the Chinese perspective that says that there is qi, which we looked at in the first session, which we acquire through our lives, through press, through food, through everything we take into our body, but also the qi that the horse comes with from their parents. That's qi that's acquired from the parents. And the optimal care of the immune system is critical for a properly functioning immune response that allows for sufficient biological defenses to ward off infection and protect the body to sustain life. So prevention is everything in the care for the immune system, and that also includes that we pay attention to the lifestyle and the lifestyle of our horses. So there are a few factors we can look at. And you see here, I'm already in the Chinese section, but it's basically the same in the Western one. So there's nutrition, the quality of it, management, like everything, the way we keep our horses has an influence on the immune system. So the better we keep them, the more ideal it is, the better the immune system. And related to that, movement like turnout and training and exercise, which is essential for keeping a body healthy. And especially the horses, which are not really made to be stabled all day. And the avoidance of stress. And that means all sorts of stress, because they are affecting the immune system. And that's also both from the Western and the Chinese perspective. But I'm back at the Western again. So you see there are a lot of parallels between our approach to the immune system and the Chinese, even though it's different wordings and different structures and different thought concepts, but there are a lot of similarities. So the immune system in TCM, it's already mentioned in chapter 72 of the Huang Di Neijing Suwen, the Yellow Emperor's Classic of Medicine, which we spoke about in the last session. It's the most basic written work on traditional Chinese medicine, the oldest. And it states, in order to defend against those infectious diseases, one should always keep his healthy energy abundant, and the evils will not invade. So again, it's kind of what is essential. It's how we care for the horse's body. And one important aspect to do that and to keep the body strong and to make sure that no external pathogens can invade or intrude is the Wei Qi. It is the defensive Qi. It is a type of Qi. We had a look in the first session at Qi in general, and there are different types of Qi, and Wei Qi is one of them. And it's like a protective shield of the body, which circulates on the surface of the whole body. And you see the relation to the skin as the outer barrier. And in Chinese medicine, the skin is regulated by belongs to the lung function, the lung meridian, and the lung organ. And it also regulates Wei Qi, the lung. And it's because it's this big outer protective layer, basically. It's the first barrier of defense and the most crucial. And equally the lung, which is basically the connection between the external environment and the internal environment of the body, the internal organs, the internal structure inside the body. And when this Wei Qi is strong, then the horse can fight off diseases very easily. It is protected by it, and external pathogenic factor have not such a very strong chance, if one at all, to affect the body and to harm the body and to damage the body. But if it is weakened, exogenous pathogenic factors can invade, and then they cause disease. And if the Wei Qi is very deficient, they can go very deep, and then they can affect the internal organs and cause harm and diseases and damages. So it's very important that we keep our Wei Qi, or the horse's Wei Qi, strong, and that goes through the lung. And we'll have a look later in relation to the points we work with and the metal element. Another form of Qi that's important when it comes to immune system is Zheng Qi, and that's true Qi. And it is the final form of transformed Qi that circulates through the body. So last week, we had a look at Qi in general, and that Qi enters the body, that there is no life without Qi, and that Qi, which is mostly translated as life energy, enters the body through the breath, the air, and through food and liquids. And then once it is in the body, it goes through certain processes which are performed by the organs and the organs' functions and the way they work together. And the final end result by all these processes is the transformed Qi, the Zheng Qi, and that circulates the body and nourishes the body and everything that is part of the body. And this Qi is vital for the functioning of the internal organ systems and everything that is inside the body, basically. And it's strongly connected with the body's ability to resist internal or external pathogens. So again, it's another one that's very important for the immune system. So we had a look at this before. So again, how can we influence Wei Qi and Zheng Qi? Through a healthy lifestyle, so that we make the life of our horses as healthy and as appropriate to their needs as possible. So Again, the nutrition, it should be of very good quality. The management as close as to their needs as it would be in the environment. I'm aware that we all make compromises and that it can always only be as close as possible to the wild and their nature's needs, but as much as we can do, the better. And of course, they are moving all day usually. So we really have to make sure that they are able to move as well. And then there's a lot of stress factors these days, and that includes environmental stress factors. And as much as we can avoid and reduce them, the better for the immune system. So, and there we have the element of metal. And the element metal is the one because of the organs that belong to it, the lung and the large intestine, is the element that is strongest related to the immune system, and also that shows the season that is associated with the metal element. So it's autumn. It's the time when the weather changes, when we are in our hemisphere more affected by from warm and pleasant weather, then we are turning to more unpleasant, colder, more rainy and other weather conditions that may affect our body if it's not strong enough, and the horses' bodies. So that means also the autumn is really a good time to strengthen and to support the immune system. So if you do want to do something for the immune system, autumn really is the time. But of course, you can work with it all year round because the daily lifestyle is essential too. So you can do it any time of the year, but the autumn is probably the time where you really should do something. But we're still in winter and it's still cold and the weather is very changeable. So it's still a very good time to work with the points that we are looking at and presenting later. So we spoke about the lung and the large intestine. And as I said, the body structure is the skin and the coat that belongs to it. And so we can really see why the lung is so essential and also susceptible to fend off external factors that could harm the body. The emotion that belongs to the lung and is grief and sadness. And we always have an emotion associated with one of the elements and then the respective organ system and major meridians. And it's quite interesting actually, because I have an example where one of my horses, she has a bit of a respiratory condition, a chronic one. It's not severe, and most of the time we are managing quite okay. So it doesn't really affect her much. But she was together with another one of mine, and this little thoroughbred, the two of them, they were together for almost, I think, 8 years, and they were sometimes in bigger herds and bigger groups of horses, but the two of them really were constantly together those 8 years. And he very suddenly died. And not only was she grieving really severely and badly, it also the day after, she started coughing and had discharge from her nostrils. So it was really visible lung element in action, lung meridian and lung organ. And from a Chinese perspective, I maybe should mention it to the ones who weren't here at the first event. When we speak of the lung and the large intestine and all the other organs and meridians in Chinese medicine, they do include the organ, the anatomical, physiological organ that we associate with the term in our language and our way of thinking. But beyond that, they include much more in a Chinese perspective. There are more functions, there are more, because we have the meridians and, as I said, the emotions and the body structures, and also the sense organ, the nose. And that's not exclusively, so there are additional points to that. So it's a wider view, and we have to be aware if we deal with these terms, which are the best translations that we do have in our language, but that cannot fully grasp the Chinese way of thinking and understanding. So then we move to the long meridian and the way where it flows. So the long meridian starts here with long 1, and there's the long 2. So the long 1 is really deep inside the body, but when we work with it, it's just here at the start. And then we move down here, and then it goes internally, so inside of the leg. We can't see that here on that picture, but it comes out here, like you see here. It's on the inside of the leg, runs down over the carpus and further down until it ends here with long 11 on the coronary band. And then we have the large intestine meridian, which is we spoke about it in the first session of there are 12 major meridians. And of these major meridians, there are 6 pairs. And the pairs are always composed of a yin meridian and a yang meridian. So in this pair, the long meridian would be the yin meridian, and the large intestine meridian is the yang meridian. So not to confuse you, but as an additional info, if you look closely on these pictures, there are also 2 meridians on each. And they have also a connection and an association. And it's basically the 6 stages, I think it is in English. It's another way of classifying and sorting the meridians, and it helps when you in practice with TCM practice and point selection in acupuncture, and what meridians you work with, how they are related to each other. So it's just another way of structuring. So because the deeper you get into it, you will see there's a lot of structure in what at the beginning I think seems to be totally confusing and doesn't make sense, doesn't seem to make any sense at all, but it does. So the large intestine starts here on the coronary band with large intestine 1. It runs then up to the carpus, and at the carpus it changes to the outside, because mostly yang meridians flow on the outside of the body. It's just not straight here, so just this tiny bit goes on the inside. So it flows further up here, goes here over the shoulder and up the neck and down here where it ends just beneath the nostril. So, and from here we actually go to the points already. So, and the points we look at now, they are all points to strengthen the immune system. And because not everybody was here attending the first session, we'll have a quick look at the contraindications again. We don't go into them in detail, but just to be sure, don't apply acupressure on infoal mares. If you have questions, please ask them. And directly before or after feeding heart feed, sudden behavior changes, because we want to be sure that there is no underlying condition, no physical problem that causes the behavior change. And in emergencies, please call the vet. So, and also please note, the way we look at and work with the points here now is that we do look, we choose points that are very, very often suitable and appropriate to strengthen the immune system, or we to address a Western indication. But that's basically acupressure on recipe. It's not really traditional Chinese medicine, and it's not a replacement for a thorough diagnosis by a TCM therapist. Just to add that and just to make that clear, because a qualified therapist might come to a conclusion to work with a point that is even better suited for your individual horse on his or her assessment. And the points we work with are just points that are very, very often the ones that worked with these indications. They cannot do any harm, but they just may not be as effective as another point could be. So, and before we start with the points as such, there are two basic point work techniques that I'd like to show you. And the first is the thumb technique. And there you work with your thumb, and you place the soft tip of your thumb gently on the acupoint on the horse, as you see there. And you do that in about a 45 to 90 degree angle. And just as a guideline, because I think the most important is that you develop a feeling for what you do, or what you, how long you work on a point, and that you work with the horse. But for the start, it's always nice that you have an idea or something to work with. You can slowly count to 20 or 30 and stay on that point. And pay attention to what you feel and what you perceive. So the thumb technique I would rather use when you work on muscle areas, bigger ones, where you have a bit more of space. But for maybe more bony structures, when you work on the leg, or when it's kind of, especially like around the carapace or the hock, or on at the head, where it's just all a bit more constraint, you can work with the two finger technique. And there you would place your middle finger on top of your index finger, and you would use the tip of your index finger to work on the point. And again, you do it very gently and lightly. You put your finger on the point in a 45 to 90 degree angle, and as a guideline, count to 20, 30 slowly. And that's the time. And again, pay attention to what you feel and perceive, and just develop a feeling how long is the right time to work on, how much is enough. It can be shorter, it can be a bit longer. It's just you'll get an idea over time how long the work, when enough is enough, or where maybe there's a bit more needed. So, and we are back at the long meridian, because the first point we work with is a point for the lung, on the long meridian, and for the lung, to support lung function. And that is lung 7, and that's here, but I have a clearer picture here, and that's where you see it. And lung 7 is on the level of the distal border of the chestnut, cranial to the cephalic vein. So I have another one, because that's where you see it even better. So if you see here, there is the distal border of the chestnut here at the bottom, and that's where what you use to as an orientation. And on that level, you move forward, cranial to the cephalic vein. You feel that vein if you not see it already. And just before that, there is lung 7. And also usually acupoints, you can, when you feel for them, pay attention. There's usually a really small little dip, and that's where the point is. So because we may have the anatomical description where a point should be, but maybe, like, for example, if I have the point, the anatomical description says that point is here, on my body it might be just right beside it. So this is why I think to accurately locate them on top of the anatomical description and also your anatomical knowledge to find the point, you then also should develop the feeling so that you know, okay, now you're on the point. And pay attention to the horse, because some horses are really very expressive. They really say, when you are on the point, they say, you know you're right. So it's sometimes you really have horses that work with you in that way. So you actually know when you hit the point. And so that's the location. But I've also, beneath the location, I've included some of the TCM indication. That's just an additional info, because we can't work with that yet because we are lacking some of the TCM theory, like, because lung 7 also disperses wind and circulates lung qi. But we can use that one. It's also the master point for the head and the neck. In the first session, we had included a quick look at the association points, which are used for diagnosis and treatment as well. That's an acupuncture, an acupoint classification, a group of acupoints. And there are several groups and classification of acupoints, and master points is another one. There are 6 master points, and they refer to a certain anatomical region. So lung 7 is the master point for the head and neck. That means if you have a problem on the head or neck, lung 7 is a point that you can work with to address that and to support that, because it's the master point for that area. So, and then the Western indications, because we are looking at the immune system today, it's of course a point that is beneficial for the immune system. But it's also a point that you can use for respiratory issues like cough and discharge from the nostrils, but also because we can usually work with local points, so-called local points. If you have a problem in a certain area, you can work with points that are close or around that area, or maybe sometimes even on that area, to address those problems, because you have the meridians running through it. And so by that, you can, working in that way, you can address problems in certain areas. So in this case, it would be problems with the forelimbs, and in particular the carpus, because it's just above the carpus, and the long meridian then runs down here basically over the carpus. So it's a very good point to work with if there is an issue in that area. And then next we are back with the large intestine meridian. And on the large intestine meridian, we work with large intestine 11. And we look at this again here. So large intestine 11 is located in the depression at the lateral end of the transverse cubital crease, cranial to the elbow, and just cranial to the lateral epicondylar of the humerus. So that's where it is. And you usually find a dip there. Like you basically, you see that here, and you can really feel it. And the Chinese indications, like dispels wind and transforms and disperses stampede, etc., we are not going into detail with that, but it just gives you an idea what Chinese indications are, and if there's any TCM therapist here, you will be familiar with it. So, and again, another immune stimulating point, but it's also to work with, a good point to work with for fever and forelimb pain, inflammation and stiffness. And in this case, it's again the local point, which we mentioned at long 7. It's in this case, it's particularly shoulder and the elbow because it's based in that area or close to. Another good point, because like, for example, we have a point here between the thumb and the index finger, just here in the middle. And that's large intestine 4. And large intestine 4 is if you're getting a cold or something, this is a good point that you can use or try or to catch it a bit. And large intestine 4 is equally also in equine TCM acupuncture literature mentioned for very similar indications and immune stimulating as large intestine 11. And large intestine 4 is just medial here at the level of the head of the splint bone. You can use that too, but I learned that large intestine 11 is actually the stronger point of the two of them. So with horses, like with humans, you would use large intestine 4 rather than large intestine 11, but with horses, you use large intestine 11 rather than large intestine 4. So, and we have another meridian now, because also we have touched on Zhang Qi and the internal organ functions, but also like the digestive tract is very important for a functioning immune system. So it makes absolute sense to include the stomach meridian in an immune system strengthening session. Also, the point we will be working with on the stomach meridian, which we will look at in a minute, has a few other functions or benefits that you wouldn't necessarily associate with a stomach point. But let's first have a look at the meridian. The meridian starts here with stomach 1, just beneath the eye, and it runs then here forward, down on the head, runs further back. It goes up here above the eye, but it runs down again and actually runs down here in that groove on the neck. And it goes down then just between the forelegs and runs further backwards here on the belly, all the way in the abdomen. And here it actually turns inside the body. It doesn't run here on the surface of the body as the major meridians usually do. It turns inside here. But it comes out on the leg again and runs there craniolateral. So it's actually very much cranial on the leg, but just slightly lateral. And it goes up here, but then further, and then here cranial further down the leg. And it runs, it ends with stomach 45 in the center of the coronary band cranial. So, and the point we will look at in more detail is large intestine 36, which is about here. Let me put it down. So we'll have a better look here. So, and the localization is in the depression just lateral to the distal aspect of the tibial crest. So you see that here. Here's the point. Craniolateral on the tibia. So if you want to locate them, I didn't put this point on a live force here because it can be quite confusing, because with some horses it's further up and with others further down. So if you it's better if you really use the patella maybe to orient yourself, and then palpate for the tibial crest and the tibia, and then you'll be able to find it, and you feel this depression, and this takes a bit of practice, but you can locate it. So, and there we have another master point. So stomach 36 you can also use for any problems of the cranial abdomen and the gastrointestinal tract. So anything in that area, you can always use stomach 36 as well. Besides immune stimulation, it's also, as we said, just a point to work with for gastrointestinal problems, also ulcers, stifle problems as the local point. But also it's a good point to include to treat asthma and cough. And there we have a point that really is contraindicated during pregnancy, because there are a few points that can cause abortion. So we need to know what we do. Please don't do, if you're starting off, don't do any acupressure on pregnant mares, but particularly here with this one, it's really contraindicated during pregnancy. And our last meridian that we look at now, it is the kidney meridian. The kidney meridian, we touched on it earlier and also in the last session. The kidney area, meridian and the kidney organs, it's basically where we house the life energy and store the life energy that we come with, that horses are born with. And it has a very strong function also in keeping our body healthy and strong, because if we are not able to keep our main life force and energy strong, then we are in trouble. And the kidney meridian, it starts here medial, caudal-medial on the coronary band, runs up the leg, and then here over the hock, not in a straight line, a bit of a zigzag, and goes further up. And actually you can't see it on this picture. I have another one here. It runs further. So here you can see where it, in the circle, and it goes up and runs forward on the belly, and it ends on the chest. I think it should end here rather than, it's a bit low down. You will notice here that's kidney 27, but they have kidneys 27 further up as well. That's a different source. You will notice when you go into the literature that different authors can have sometimes points a bit at a different location. Here, as you see, the meridian ends a bit differently than with the other one. And also sometimes the descriptions are a bit not always the same. It can be a bit confusing, but you just have to figure out for yourself. Just be aware that there may be differences. And so you've already seen that's the point we want to work with. That's kidney 27. And that's the last point on the kidney meridian. And it is in the depression over the descending pectoral muscle between the sternum and the first rib. I mean, that muscle is very clear, and you can feel and palpate for the sternum, and it's just like slightly lateral to it and just over the muscle, like it should be here. And it is what is a bit particular about the kidney 27 is that it is the association point of all association points. The association points we have looked at in the last session, the 12 points that are connected with all 12 major meridians and the 12 Sang Fu organs. So it's basically, it's kind of a bit encompassing and all of them, which makes sense when you think of the kidney being the place for the chi that you come with, the source chi, and also the essence. So it's it shows you from basically makes the bridge to why we use it for immune stimulation and immune system strengthening. It also regulates lung qi and stimulates the kidney function of reception of qi. So, but that belongs to the processes of qi in the body that basically the kidney receives the qi from the lung before it's further processed. So, and as we said, it's a good point to strengthen and stimulate the immune system. Also, as a local point, it's a good point to work with for any chest problems, chest pain. And again, it's the location also for with asthma and cough, and also the function of the kidney in that regard. But we won't go into detail in that. We may look at it in the next session on the respiratory issues. So it's just to keep in mind, it's also a point you can include for respiratory problems. So that was our last point here. And then basically you can go ahead and work with it. And there's different ways, basically. I mean, if you like to extend it a bit and try it, you can. And you were here with the on the first session. You can also combine it with the work on the bladder meridian. So you can basically start with sweeping off the bladder meridian. Then you can work with those points. And then you can close off the session with the bladder meridian. So that would be going into the direction of a full acupressure session as you do them, without the TCM, the proper TCM diagnosis. But you can, of course, just pick a few of those points, or you can try which of those points that we've mentioned your horse responds best to. And also then work with those points on both sides of the horse, just for balancing, because the meridians flow on both sides of the horse. And also we had, because this is a re-recording of the live seminar, because there was an issue with the recording, we had spoken there about permission. And like, we never work on points of if the horse is resisting to it. It should always be comfortable for the horse. We don't force a horse to have applied acupressure on it. So we always work with the horse. But also that means that before we start working, we ask for permission. We go into the work with a healing intention. We try to be grounded and present. And the permission, we can ask for permission silently, but we get in communication with the horse. And I know somebody mentioned there in the actual session that and that's a perfect example. She was doing something, if I recall it correctly, doing something on a donkey, and he was kicking, and he was loose actually, and he would start kicking, and she just told him, you don't need to kick, you can just walk away. And so he did. And we basically we allow the horse a choice. But if the first response is that they say no, we can try another approach. We may want to change the location that we are working at that time, and maybe that changes the situation. And maybe we can even change the location another time. a second time. But if the no is that clear, then we won't work with them, and we may try at another time. But it's actually rare. So just to make sure, the work should be ethical, and we are also not working on points that are painful, never. So if you are getting strong reactions and resistances, it's not really the time to work on that point. But make sure you know why that reaction is there, or find some solution for it. Yeah. And also, for example, if I was asked in the German version of this, because is a mare that doesn't like to be touched on the neck, and she gets very anxious and panicky if she's being touched on her neck, and but otherwise she's fine, and it has been checked that there's no underlying health condition, and she's otherwise, apart from grooming or massaging, she has no problem with being touched on her neck. So it's just in these situations. So in that case, I would just work around it. I just wouldn't go near that area where she gets reactive. I would then start working on the platter meridian, starting further at the back, maybe at the withers, behind the withers. And if then you may get closer to that point at some to that area, then that's fine. But we don't want to cause any aversive reactions. It's a bit different when you said acupuncture needles, because of course that can sometimes be a bit painful. It shouldn't be painful once the needle is in. If you then still get strong reactions, you must pull the needle out, and you must stick it in again or try whatever. But the moment you put the needle in, they can be reactive. Just if you have an acupuncture practitioner, that's okay. So that's nothing. It of course shouldn't be bad, but it's also, if anybody of you had applied acupuncture on themselves, you may know that it can hurt sometimes a bit when the needle gets into the body. But with acupressure, we really don't want this. We just really want it to be gentle and nice and comforting. And if they are a bit fidgety or something like that, that's fine. It's but again, it's practice, observation, and working with them rather than just going there and applying just a tool. It's besides being a technique and modality, it includes communication, and it includes communication between the practitioner and the patient, and in that case the patient is the horse. So as we are not in the live session with the question and answer part in a real situation, if there's something that you'd like to add, or any question that you want to be clarified, please drop them to me, and I will add it on the page where you all have access to, the recording and the download of the presentation. And some of you I will see soon at the next webinar. Thank you for your attention, and bye-bye.